Hello, welcome to Renew Education. This is another case study. This is a full arch case. This is kind of a mess, if you can tell here. There's so much going on historically. I'm not clear on what the cause was or is. This might be dry mouth due to illicit drug use for a time period in this person's life. I do see that quite a bit. And here's what we're left with: a lot of root tips and not a whole lot of oral care, hygiene care, anything that's going to help support if this patient was going to elect to do what I call tooth by tooth dentistry. Now, this falls into, and we're only going to talk about the upper arch on this video. There's another video that talks about the lower arch. So on the upper arch, we do have one of the 50-50 rules. If you don't remember the 50-50 rules that I have, one is about how long the actual tooth is relative to how much bone is actually supporting that tooth. And the second one falls into this one where we're looking at how many teeth in an arch do you have. So this particular case just about has the 6. So if you have 6 or less teeth, you have to consider taking out those natural teeth, unless you're looking at something to maintain those teeth. The habits change for the patient and they're looking at spending more money. So that's always what I warn them to do. So let's look at what the treatment assessment says here. We got yellow facial bone. We have orange constriction areas. We have yellow sinus. We have orange on repeatable bite and posterior support. So that will get us kicked off in the right direction, and we will kind of look at this further. So let's look at that. What exactly is going on in the sinus here if we take these out? That's the big question, because when you get into this stuff here, you don't want it to collapse away, and you don't want to be doing immediate placements where you may lose the bone that you so desperately need because you've got the sinus right above it. And you don't want to start getting into sinus lifts if you don't have to. It's an added expense, and it's certainly more of an added time. So let's just look at this area here. So this would be somewhere where I'd be considering looking at putting in the implant. It's that first molar area, and things don't look too pretty. I'm going to go right across this area. This is what it's going to look like. So the tooth roots are kind of curved, but we do have bone on the outside here. So we have this bone on the outside, and you have it interseptal bone, and then you have the bone here. So we can reasonably say that when these are out, almost even if you don't graft it, you're going to have bone fill in these particular areas, probably at least to there. Now, how much room do you have to the sinus? Well, you've got at least 9 millimeters. So you could do a 8x5 here. You can do a 10 and just bump it into a millimeter. That might be really good. When you have what they say bilateral stability, when you're getting into the cortical nature of the bone on the floor of the sinus, as well as the bone that's going to grow up here, you get very good stabilization of the implant, and long-term better stabilization of the implant. So this site's a winner, even though it doesn't look good, but this is a 2 bone healing event. You have to realize that when you take these teeth out, you do a graft. You don't put an immediate implant in there. So you want to wait and let that heal. Going into the other side, or let's just move forward into the premolar canine areas. This patient has a canine that looks like this, and that doesn't look too bad either. I don't like the little facial part here, but the facial plate here looks good and strong. I'm not a big immediate placement guy, so let's just put an implant in there. Maybe we take a 13 by 3.5 or 13 by 4.2 diameter. Let's see right here. That's a 4.2. That might be the ideal here. You stay away from the facial plate as much as you can, but our implant would slip right in there and like that. So you can definitely do this and cover up to the lingual wall. It is tricky to get that as an immediate implant. and you don't want to perforate out here. The bone is very similar when you're drilling, so you won't know or feel the softness of the medullary bone versus the cortical bone until it might be too late. So this is a tricky immediate placement. Your implant will probably end up getting pushed more like that, which could be okay too, and you probably don't want to drop it that far in, but maybe something more like that. And that's doable, and it's a little bit easier to get it in. You keep that really heavy lingual plate of bone here. You will risk that resorbing here. This should hold it back. You can always graft and do things like that to maintain it. So that looks pretty good. And then if we were going to focus on something else over on this canine area, that would be good too. So you got the same scenario on the other side as you have here. You have a nice little facial plate of bone. You have a decent amount of width of the constriction, but it's still doable. Your angulation is not what I like, but if you're doing an overdenture or hybrid, you can kind of get away from that. So does this patient have some sort of ortho flare that would cause this to off center and fall down and be more difficult for the patient later on? No, not really. At least in this CT, she's biting in an edge to edge, but that angulation looks really good. The supportive bone is right below where the crown is. The supportive bone here is right below where the crown is. So you have a nice compressive load. If you were biting in a class 1 position, it would still be the same. It wouldn't matter. So let's go all the way to the back here. And here's where we look at this molar site here. I'm going to go right down in the middle of that embrasure, and that bone looks really good. It's a little bit thin over here in the sinus, but that's okay. But when you scroll through and you want to see the root takes up quite a bit. And then if you go backwards a little bit, you have the palatal root goes actually into the sinus a little bit, and then you have very thin facial bone here. So on the posteriors on both sides, over here and over here, I would recommend when you do those extractions, make sure they're atraumatic. You just take the roots out and graft those sites. You got a bunch of other little things going on here, and I would probably just insist on getting all the teeth out. Since you have to wait for these here, then if you have to wait, then maybe wait for these as well. You don't have to go for the immediate placement in this case. So this is a 2 bone healing event for locator or some sort of hybrid if you want out for, or you would do even more. You can do what I call all on 8, which is 4 3-unit bridges. So you need 8 implants. You could do that. You could do 6 implants with a locator system. So this patient, as bad as she looks with natural teeth, has enough bone, has enough height, has enough sinus height, has enough quality that this patient could actually do very, very well, even though it starts off in a situation that doesn't look so pretty. Doesn't have to be pretty, it just has to look pretty when you finish. So this case is a great case. I would say this is probably a little bit higher of a level than just a basic edentulous case where you have good bone, because you are dealing with making the judgment of whether you should do immediate placements or not immediate placements. But in this case, if you don't have to do an immediate placement, then I would say probably don't do that. I don't think you're going to gain anything by putting 2 here, and then you still have to wait for the 2 in the posterior. Some people say, well, you can put locators on there and help support the denture. Yes, you can, but you also might torque them and put a little bit more biomechanical load on it that you weren't intending to do in a time period where it may not be fully healed. So be cautious, be smart, and things can go in your favor very, very well. If you're not, then they can go very, very in the wrong direction that you don't want them to do. So anyway, that's this case. We talk about the lower one, so check in on that one, and subscribe to us on YouTube. Check us out, give us a thumbs up on Facebook, and check us out for some of our live stream podcasts that are through the week on including Twitch and Mixer, YouTube, and Facebook. Great. Thanks a lot. Cheers.